Welcome to Medical Sales U. I'm your host, Dave Sterrett, and we are the podcast where we're helping bring real conversations to top professionals in medical sales and those who've made the jump into medical device or pharmaceutical sales, and now they're making an impact in healthcare. Today, I'm excited to talk to Catina Pitzen. She is a senior oncology sales representative at Eisai, and she also serves on the local board of the Columbus chapter of the Oncology Nursing Society. Catina, great to have you on the podcast.
Thanks, Dave. Great to be here.
Catina, our paths have crossed a number of times. I think, met you when I was actually, a couple years back, I was interviewing with Eisai. And I remember reaching out to certain reps, and everyone I talked to said, well, you need to talk to Catina. She is making a difference. And then we ran into each other at one of the accounts, and I came to realize that you were involved with the Oncology Nursing Society. So I thought on this show, as we're helping people make the transition, so in our program, we've had people join, a couple nurses join, wanting to get into medical sales. Obviously, we don't want all nurses getting into medical sales. We need nurses as well. It's not for everybody. But you have a unique perspective. And I thought about maybe if you could tell us, one, what do you currently do? And then we're gonna hear a little bit about your journey because you worked as a nurse before you got into medical sales. So maybe tell us, what do you do today? Tell us a little bit about your role.
Oh, goodness. Well, you know as well as I do that, thankfully you understand the oncology side because I feel like that this role is a whole different beast than anything ever that I've been in pharma before. And I've been on the pharma side since 2006, so almost 20 years, which is hard to believe. I've almost been on this side longer than I was on the side of the bedside as a nurse. But, I would say in oncology, when I was thinking about it, you had, shot over a few questions or things for me to think about for this. And one of the things I thought about, a lot of my job is spent planning, planning or strategically figuring out what my accounts need. Because as you well know, in oncology, it is very difficult to get in front of people. And so when you do get in front of people, you need to know what you're talking about. I am on OncLive, on Target Oncology. I listen to Research to Practice a lot when I'm on my way to appointments.
I love. And by the way, for our listeners who are just curious about some of these things, we'll even slow down there. So there's those wanting to break into, say, oncology sales. I've had several people who are in medical device, and because they have little kids, they've come to me wanting to get into oncology sales or a different field. And you've mentioned several podcasts, several things to listen to. One is Research to Practice by Neil Love. I actually just reached out to him to ask him to come on the show because if you're a new rep, I do think that's a great resource. When you're in the car, download his podcast. Whatever disease you're interviewing for, download it. And he probably has an episode on the drug that you're selling and also the competition your drug is going up. And he's got so many episodes. So that's good. What else did you mention? You said research practice.
Research to Practice. And that's my big one. What I was going to tell you, Neil Love, I love, like he's my hero. I ended up actually at a nursing conference and he was doing one of his Research to Practices live. And one of my thought leaders from OSU was up there. So I ran up to say quickly hi to my thought leader, but then I ran immediately to Neil Love and said, when this is over, can we please get a selfie? And
there you go.
Like, yeah. But when I started, recounting different podcasts to him and things that were said on them and funny things that he repetitively said, he was like, you really do listen. And I'm like, yeah, I spend hours in the car. So
good for you, Catina. So good.
To me, I live in Mansfield. I work primarily out of other locations like Columbus. So if I'm in the car for an hour, I don't want it to be wasted.
I love that. You're always learning. And I just want to pause there because that is so important. I think there's so many of us, we're thinking about our accounts. We got to check the box. we zone out. And there's a place for that at times. I mean, I put on some country music.
Oh, of course.
Too, but at the same time, if we can learn and grow in the car, and that's a great resource as well. So that's good. So you live in Mansfield. How far away is that from, say, some of your largest accounts?
Most of my accounts, an hour or less.
Okay,
but
it's not bad.
I do cover Youngstown and up that way, and up to Boardman. Some of those accounts are a couple of hours.
Okay.
But the majority of my time spent around the Columbus area.
Yes.
And in that vicinity, so within an hour either way.
Well, I love that your pre-call planning. You're right; these accounts are so complex. But you started your career as a nurse. Tell us a little bit about that career. What did you specialize in, and what did you enjoy most about being a nurse?
Oh my goodness! Now you're speaking. Yeah, you're speaking my love language. I come from a long line of nurses. My mom was a nurse. My aunt's a nurse. My sister-in-law, my brother married a nurse. My son is about to have a fiance that's about to get her residency assignment. So we are a medical family.
It's in the blood.
It's in the blood. And so, I thought that I was going to go on and go on to medical school. But as I was going along, the more I learned about nursing, much to my mom's chagrin, I thought maybe this is the route I want to take. I really like the fact, that I'd be dealing with patients more and not just symptoms. And so I ended up, back before HIPAA, you could actually hang out on the floor. So my mom was a labor and delivery nurse. Excuse me.
Really?
And I spent a lot of time as a teenager there. And I ended up, long before HIPAA, they used to throw me in scrubs and let me run around with the residents because I thought I wanted to be a doctor. And so one day, one weekend when I was with them, all of a sudden a delivery was about to happen. And so the doctor in charge of the residents said, come on, we're all going. We're going to go deliver this baby. And so he put me right down there with the residents. And so I got to watch my first delivery. My mom was the scrub nurse in the room. Really? And all I can remember her saying is, stay away from the sterile field. Don't get near the sterile field. And I was like, I'm right here with these. But that developed this great love for labor and delivery. And so the majority of my career was spent in labor and delivery, both before I became an RN and then even after. And when you work in labor and delivery, you also are surgically trained. So that always leads all of us. Sometimes we'll moonlight in the OR, or, we'll take jobs over in same day surgery and stuff. And so I've done a lot of that. I did a lot of GYN in my nursing career too. And then my last 3 years were actually spent working with a plastic and reconstructive surgeon. And he was terrific. And I loved that field too. But how I ended up in it was his wife happened to deliver a baby in my labor and delivery, and I happened to be the one there.
Oh, really?
So she was an RN, and when they were losing their office nurse, she and I bonded during that delivery. And so he approached me in the same day when I was moonlighting down there one day and said, we're losing our office nurse, and we'd love to talk to you about it. So that's how I ended up with my last 3 years really at the bedside. Plastics.
What a variety from from plastics to now. Which one was your favorite? Do you looking back? Which?
Labor and delivery, hands down.
Yes.
Yeah, GYN, labor and delivery, women's health, which is why I ended up at Eisai in women's health eventually.
Well, tell me that? How did you go from Eisai? What was the connection there?
Well, so how I got into pharma was we moved from Tennessee to Ohio. And at that time,
I knew this was in an Ohio accent I was hearing. I'm like,
no, sir.
This girl's from Tennessee. She's from Tennessee.
So my husband is from Ohio, and he's a railroad engineer. And they moved him back here to Ohio. And at that time, our kids were small. And we didn't, labor and delivery, especially when you start, it's nights, weekends, holidays, call. And that wasn't something with him traveling that I had the ability to do. So I had some friends who made a comment, gosh, with as social as you are and with as much as you love to talk, you should look into pharma. And so, Dave, I did. I went up to a job fair up in Cleveland. First interview, first job fair, all of it. And there happened to be a position open in Mansfield, which evidently had been open for about 6 months because nobody wanted Mansfield. And at the time, I didn't know better. So, but the managers, I ended up getting hired in primary care on a contract with BI. And so I went through contract. But the funny part was the first manager, who wasn't the hiring manager that met me, he stood there for a minute as I talked, and my accent was a whole lot thicker then, honey.
I like it. I have one too.
Like, he said, hold on a minute. So he called the hiring manager over, and the hiring manager came over, and he said, this is Rick, just talk to him a minute, And I said, well, what do you want me to say? He's like, just talk. And I watched them both grin, and Rick looked down, he's like, you want Mansfield? Why do you want Mansfield? And I explained my whole situation, and they both were like, oh yeah, like this will be great. And so I always laugh and tell people I was hired, for my accent.
That's so good.
You mentioned something in there about nurses. One of the things, you wanted me to think about was not every nurse is meant to be in sales. Yes. And I'll never forget that the hiring manager, when he gave me my offer, he said, well, you'll either be the best decision I've ever made or maybe one of the worst. And I just kind of said, what? And he said, nurses are either really good at this or they're not. And he said, we'll just kind of go for it and see. And thankfully, he believed in me, and he did a lot of coaching. Mm-hmm. A lot of coaching on closing, because as a nurse, we're not good at that, not coming out. So that's how I got started in sales. How my career has evolved is, different things that I would love. I would end up, going toward those particular disease states. But I went back into how I ended up at Eisai. I went back into nursing and did compliance medicine and counseling for a couple of years. I thought, well, maybe I want to go back, and just be in healthcare for a little bit. And while I was in there, I just realized I missed the sales. I missed the sales of it. But I thought, you know what? I've earned the right now to really choose the field I want to go into. And I had no idea that oncology was I had no idea that it was one of the high rungs of pharma sales. That was something nobody ever taught me, and I never learned. But this was a position in women's health, and it was in something I was very passionate about. And I just accidentally had a friend who was already on the team that I wanted to be on, and so I reached out to her. And the rest is kind of history. She put her name behind mine, and they gave me a shot, having no oncology experience. But I think I've proven myself. I've been there 6 years.
Sure. And I've seen you around Columbus. You're a connector. The other reps. I've seen you, the Oncology Nursing Society. And but you're right. Not everybody is naturally as outgoing as you are. You have a woo factor with like your accent made a point. It's just like I'm not from Columbus, Ohio either. I've tried to embrace it. I mean, I'm loaded up with Buckeye gears, and I'm glad, OH, but IO, but I grew up in a small town in Virginia. Then I was in Texas for 15 years. But you connected really well. And now, as we think about this, there are some nurses who just wouldn't be a right fit. But for those who are contemplating maybe going into medical sales, because we want to, in our program, and I try to talk some people out. I'm like, medical sales is not for everybody. I think it's a great, incredible career for some people. And we don't need every single clinical person in this field as well. But there are some skill sets and I think some tendencies and personalities. What do you think if there's a nurse wanting to go into medical sales? What type of nurse would be a good fit? Like, what would be a good fit for those? Because we obviously don't want all, but for those that are thinking about it, what nurses would actually be a good fit for sales?
For device, when I think of device and things like that, an OR nurse,
Yes.
if you're going into the OR, I can't imagine that there would be anything more valuable, most of the time, that's an area that you understand. So anytime anybody who's been in OR has asked me that question, I'll steer them kind of in that direction and say, do something,
Yes.
Go for, if for instance, I would have done great if I were the liposuction person. I could go after I worked in plastics and do that. Or, funny enough, at a conference not too long ago, I was beside the Ethicon reps, J&J.
Okay. Yes.
And we were talking suture. And I mean, it was like riding a bike. I jumped right back on. I'm like, 3.0 Vicryl, this. And I mean, they even taught me a few things. But to me, like, that's something I'm passionate about. I love.
Yes.
So I always try to steer somebody in that direction. Now, we are starting to see, and I love that you're doing this because I'm somebody, a lot of people have reached out to me for this very question, or that somebody's told them, hey, call Catina. She loves to mentor and do this kind of thing, because I think that's so important, especially those of us that have made it up this far. We need to reach down and pull others up.
Yes.
But the other thing, like with the oncology nurses that have reached out and said, hey, like, I might want to get into oncology. And we talk about that. I just talked to them about, why do you want to get in? What are your thoughts on that? And, what's interesting, one of the nurses that I actually work with at Eisai, she was turned down 3 times, I believe. She's a nurse practitioner.
Okay.
In oncology, just came out. But again, the nurse factor, she didn't have sales background.
Okay.
And her thing was, I'm selling every day.
That's
if you don't think I'm selling every day, I have to, the doctor prescribes the treatment, but I have to sell it to the patient. Mm-hmm. And I thought, what a great perspective. I'd never thought of it that way. So
there's patients with all different types of personalities. Some are apprehensive about a treatment, and a nurse has to take complex information and make it accessible to that patient. And that's why I do think for some nurses, not all, but for some, there is that potential. You talk a little bit about you referenced Florence Nightingale as a source of inspiration. And I just wondered if you could maybe just comment on that or share a little bit about even how that, your company's mission and just the inspiration of how she thought outside the box. And she influenced definitely nurses, but also pharma as well. Can you speak to that at all?
Oh, yeah. I mean, Florence Nightingale, she made nursing what it is today. I mean, it's almost like the Constitution. We still use her notes. We still chart in the ways that she taught us. Our aseptic technique and sterile technique came from her. But the biggest thing she taught us was that our main role is to be an advocate, period. And that is either advocating for patients who either are unwilling or unable to advocate for themselves, and also their caregivers. And when advocacy was in her heart, and she wanted to she had 2 principles that she worked off of. One was equal rights for all humans. And then the other had to do with leadership, and that we, carry who you are carries the message as much as the message.
Yes.
If that's why nurses wore crisp white uniforms. That's why we had certain rules in the very beginning, and a lot of that was to show that leadership.
Love it.
And so today, I still see myself that way. My manager is terrific. It was almost your manager. He's great, but I think Kenny's gotten used to me saying, I don't see myself in sales. I see myself as a patient advocate still. And that's advocating for how they can get the treatment. And also on the other side, making sure that the providers have the correct information to work off of so they can make the best treatment decision. But the nurses too, because I know as a nurse that I heard so much more from a patient than the provider did. My surgeon, when I worked in plastics, could walk in. He would be in there 2 minutes. He would he would come back out and he would say, okay, they're ready for you. I would go in. I would be in 15 or 20. I would come back out and say, you're going to have to go back in because she's just told me 5 other things that she wasn't willing to tell you. Wow. And that is especially in oncology. I have an oral therapy, but I spend a lot of time with the infusion nurses and educating them because my oral therapy is given in combination with an infusion. And yes. I know that those nurses spend more time with those patients than do my RNs that are in the office or medical assistants in the office or the doctor.
Wow. How do you build relationships with infusion nurses? I think they're busy and that's good. That's good. I like that.
The first thing out of my mouth is usually, I'm a nurse. I get it. I know you're busy.
No, I love it.
But
so
I am myself. And that's how I promote, sell, advocate. And again, I usually, if I don't know them and I need an appointment or I have a reason that I need to get in there and do some education, I'll usually start out with that. And when I start telling them, hey, I know you have this patient, I know you've seen Betty. I had Betty when I was, doing, and I usually just take it to the patient level and say, don't you have that one patient that always has to be in your chair? And you know her better than anybody. And usually about that time, I have heads up and they're all like, because we all have a Betty. We all have that one patient. And the thing that I know about that is Betty's going to tell me as a nurse more than she's going to tell the provider. And I'll give you, for instance, let's say she has a tooth she needs fixed back here. She's not going to think to tell the doctor, or the nurse practitioner in her limited amount of time with her cancer, oh, by the way, I'm going to the dentist and he's finally going to fix this broken tooth I have back here. And I'm just so tickled about it. She isn't going to say anything. She's going to tell that nurse who she's been complaining about that broken tooth to. And that may be important because at least with my particular therapy, they need to come off for 2 weeks if they're going to have any kind of dental. So it's little things like that I want to teach those nurses to pick up so that then they can pick up the phone and call and say like, hey, I think we may need to pull Betty off, her oral therapy for a minute. She's got a dental procedure, and then they may want to contact the dentist. But if we don't educate our nurses, then those little things get missed.
I love this, and especially pharmaceutical, whatever niche it is or a device. If we're just thinking about the doctor because the doctor is the decision maker, you're just not going to do good in this business.
You are going to do terrible in this.
You're going to do terrible. And so I just think building trust and realizing that if they're busy or maybe a nurse seems rude, we don't know what they're going through that day, what they're experiencing. Exactly. And sometimes it takes a couple times to build trust with nurses. But I think the more that we can educate nurses, the more it's going to help our patients, whether it's through prophylactic education. And one of the roles that a lot of pharmaceutical companies have is collaborating with a clinical educator or a nurse who will help to provide some education to mitigate adverse reactions and so forth. But it's very important for us as pharmaceutical reps. We got to see ourselves a little bit like the quarterback. And we got to bring that in and we got to build trust. And it doesn't mean that we do everything, but those nurses are such an important piece. Catina, one more question here. Tell us a little bit about the Oncology Nurses Society.
Oh my goodness. They are wonderful. and truly, you asked me about how I got involved with them. Well, it wasn't long. I didn't get in oncology until July of 2019. And we had a pandemic come through in 2020, right at the beginning. So just as I got my feet wet, all of a sudden we were all pulled out of the field. And I had started prior to that trying to engage with the Oncology Nursing Society, and I didn't know exactly how. I finally figured it out, and then we got pulled out of the field. Well, part of the reason I wanted to be a part is because I miss my nursing colleagues. I miss my friends. We are a different breed. We speak a different language. And
I know. I've seen you all.
You know, you've been around us a lot. Yeah. And I needed that. I didn't even realize how much I missed it.
That community.
Yeah, until I got involved. And so I got involved and did some virtuals with them and, made some friends that way. And then just as quick as things opened up, I started, coming to meetings. And again, I didn't know how pharma friendly they were because that's another thing. Sometimes you can get organizations that are not as pharma friendly. And I mean that, they only want practicing nurses to be a part of their group, and that's fine. Columbus Oncology Nursing Society is not that way. In fact, there are several of us that have come from the bedside and are on the pharma side now, and I love it because that helps them understand our side of things and why we need certain information and why we're allowed to do certain things, but why we're not. But the best thing for me is not only did it give me a connection and give me friends, but it opened up a whole base of knowledge and perspective. Because now when I want to know, tell me what it's like when you have XYZ patient and what they're really going through. I can find a nurse that's a friend and, say what I need to say, like, help me understand this so I can be better. And I can't tell you how many times that's happened, that somebody's helped me understand how a system worked or even just what a patient journey felt like that maybe I didn't understand before. So they are some of the most selfless, caring nurses around. And as far as I'm concerned, oncology, it's the stiffest learning curve I've ever had. And I stand in awe of them. I don't know how they keep all the indicators.
It's so many complexities. Yeah. There's always something new. I mean, just think about the NCCN guidelines, how many times it's being updated. And then anytime there's a breakthrough new treatment of a drug, well, if it's a targeted therapy, there might be maybe better efficacy, but there might be more to manage.
Exactly.
And with everything being thrown at, these nurses take on. And here, then there's always the issue across the country of these academic institutions being underfunded, right? And staff and getting burned out, these nurses getting burned out. And so I think your advocacy, understanding the community. So we love nurses, and we don't want all nurses to come over to medical sales. For some, it might be a journey like Catina's, but every single role is important. And I just think the reminder, the inspiration that you shared from Florence Nightingale is just a good reminder. But Catina, you're a connector, you're busy. So I just want to thank you so much for taking the time out of your busy schedule to join the Medical Sales Q podcast. And again, my name's Dave Sterrett for our listeners. But thank you so much, Catina.
Oh gosh, thanks for having me, Dave. And thanks for doing this. Thanks for recognizing that nurses can be good at sales.
Yes, absolutely. You got that woo factor and that personality. Have you ever done Strength Finders, by the way? Strength Finders?
I have. And I was trying to think when you were saying that about the woo, I was like, I cannot remember.
I was just curious.
I know. I can't remember what.
This is my number 5. It's not my number 1, but it's in there somewhere. But I think you have a little bit of it. I think a lot of salespeople do, but not all. Some are more. Some are very calm, and that's the great thing about pharmaceutical medical devices. Some are just very calm, and they're not working the whole room, but they ask good questions.
You were asking me, which nurses shouldn't. I would say this. You need to not wear your heart on your sleeve if you come out of nursing and go in, because I think that's the biggest transition is. All of a sudden you're seen through a different set of eyes. As a nurse, we've been voted the most trusted profession for the last 50 years. Then all of a sudden, you've gone to the dark side. Yeah. And that's hard. That's hard as a nurse. Some nurses, I can see that's probably why they don't transition well. It took me a minute. I will be honest, it took me a minute. I had to figure all that part out. So
I was talking to a nurse recently a pharma rep whose mom was a nurse. And when the pharma rep then said how much she was making, it made, her mom even be like, what, and so there's challenges and complexities. There's no doubt that different professions. I was a teacher. I taught at a private school and made less. And so I think there are seasons and callings on different people to do the hard work. We're not in it for the money. And I don't think any nurse is in it for the money. So we appreciate, we love nurses. But Catina, thank you so much. I look forward to seeing you in person.
Yes, I will see you soon, I'm sure.
All right, we'll see you soon. All right, thank you so much.
Bye.